presuming that you are all potential counselors in your institutions. Counseling is a helping profession. When I say profession, it means that you have to get a degree or a diploma or a certificate from okay. ಸ್ವಲ್ಪ, the problem is with the online only, not with me. Okay. Friends, I repeat, counseling is a helping profession. When I say it is a profession, a professional must have an advanced academic qualification, extensive training, and recognition to practice in a particular field. On the basis of 3 conditions only, we say that you are a professional. Counselor is a professional. A counselor provides help or service to people. The person who receives service is called counselee or the client. Client means a person who receives help or the person who has the right to receive help is called as a client. So you are a counselor and the person who receives service is called client. When I have chosen this topic, counseling services, I feel that you are all potential counselors. I will just mention the requirements of a counselor. You have all the requirements to become a counselor except one requirement. That requirement also I will mention at the end. But before that, what is helping? What do you mean by helping profession? When I say helping means the help is of 2 kinds. One is a reactive help. The second one is proactive help. Reactive help means when help is given to someone who asks for help. A person has asked for help, you have helped him. This is called reactive help. Or help is given to someone who is seen as needing help. He has not asked for help, but he requires help. You have identified the person and providing help to him. Help or service, whatever it may be. This help is called as reactive help. You are reacting to the need of the individual. Whereas proactive help means when help is provided because of the helper's need to give help. I explain further. Proactive help can be compared to that of dana. When you are giving dana to someone, giving dana is your requirement. Receiving dana is not the requirement of the other person. It is your need to give dana to somebody. There are some professionals who provide help to people without being asked for it. They provide help to others because of their self-satisfaction. They are all committed professionals. So help can be given in two ways. One is proactive, another is reactive help. Such services, you can compare help with that of a doctor provides services, a lawyer provides services, a nurse provides services. All three are professionals. A counselor also provides services. Hence, we say he is also a professional. Such services need not be therapeutic. When I say therapeutic means there is a problem and you are providing solution or providing service. This is one service of a professional. That's called therapeutic or ameliorative or curative. There are other two types of services. One is development. The second one is prevention. These two are more important than therapeutic. Development services. In medical field, we provide development services through health education to people, creating health awareness. By doing so, you are improving their health status. The second is you are preventing a particular medical problem. For example, using helmet to prevent head injuries. Polio drops are given to prevent the child from developing poliomyelitis. BCG vaccination is given to prevent the child from developing tuberculosis in the later life. Same way, in counseling also we provide development services, preventive services, and therapeutic services. So to become a counselor, the requirements I'll just mention, you have all the requirements because counseling is very, very similar to your teaching in the classroom. Many of the requirements are very similar to the requirement of a teacher. I will just give the list of the requirements. I'm sure that you have all. The first requirement, when I say requirements, mean these are all the requirements internationally, not local requirements. The first requirement for a counselor is superior intellectual ability. Superior intellectual ability and the power of judgment. That means thinking into the depth of the issues, not understanding things at superficial level, going into the depth, having analytical approach, and the power of judgment to decide what is correct and what is not correct and who is wrong and who is right. This is the first requirement. Second requirement is interest in persons as individuals, treating everyone as an individual. That is important. Treat every person as a unique person. Every person is worthy. A regard for the integrity of other persons. Show concern to people. Show empathy to people. When I say empathy means feeling like the individual is called empathy. Feeling for the individual is called sympathy. When you say, Ayo, Papa, Andre, that's called sympathy. We don't require sympathy. When you help other person, you have to show empathy. Empathy means feeling like him. Saying that I understand your problem. If you are in the same position, if the same problem comes to you, how do you react to that problem? It's called empathy. You also experience the same problem. Ide problem nanaki bandare. How do I react to this? If you are able to communicate the same thing back to the individual, this is called empathy. You empathize with people, show concern. The third requirement is insight into one's own personality characteristics. Understand what type of person you are. If you are a very, very short-tempered person, probably that is a negative quality for a counselor. We want a balanced personality, emotionally balanced, not to be oversensitive to issues. This is what I say is insight into your own personality. Even if you are short-tempered, control that when you are dealing with people. Even if you are very, very short-tempered, tumba kopa nimage bandidre, tumba kopa idre, try to control that when you deal with the issues. Don't displace this anger on somebody else. So, emotionally balanced, and you have a sense of humor also. Sense of humor means sometimes you have to smile. The smiling approach is a good quality of a counselor. Have a pleasant approach. Receive people well. Talk to them with all genuine interest. This is third quality. Fourth quality is tolerance. You have tolerance. Even if you take 3 to 4 classes a day, the last class also will be with the same interest you take. First class generally will be very interesting because it's a fresh. At 10 o'clock, you take with all interest. Second hour also, if you take with the same interest, third hour also, last hour also. That is what I say, tolerance. But no arrogance. When I say tolerance means not arrogance. Fifth quality is ability to establish warm and effective relationship with others. Technically, this is called rapport, R-A-P-P-O-R-T. Rapport means a good relationship, a harmonious relationship, a pleasant relationship, a purposeful relationship. A relationship has a definite purpose. You go to a doctor, the relationship between you and the doctor is called as a professional relationship. A professional relationship has a purpose, definite purpose. And the relationship is always positive. It moves in the right direction only. You are a teacher. The relationship between teacher and student is a professional one. The same way, the relation between counselor and the counselee is also professional. So that ability to establish warm and effective relationship, if you are able to establish relationship with the individual, this all depends upon your ability in communicating issues to people. Hence, we say counseling depends more on the communication skills of the counselor than the subject knowledge. If you are able to communicate well, that is a very, very good quality of a counselor. The next one is methodological work habits. You start your work at 10 o'clock, work up to 5 o'clock. You have a methodological work habits. You have a timetable also. You work according to the timetable.
Excuse me, sir.
Yes, Amma.
Sir, slides are not moving, sir.
No problem. I am not moving. I am still here only.
Okay, sir. Okay.
Okay, I'll come, Amma.
Okay, sir.
Okay, next one is methodological work habits. These things are not there in slides. I am just explaining to you.
Sir?
Yes, sir. Yes, sir. Somebody wants.
ಸರ್ ಮುರುಗೇಶ್ ಅಂತ ಸರ್ ನಾನು ಪ್ರಶ್ನೆಗಳು ಕೇಳಬಹುದಾ ಸರ್ ಇನ್ ಬಿಟ್ವೀನ್ ಅಂತ
ಇನ್ ಬಿಟ್ವೀನ್ ಕೇಳೋದ್ರ ಬದಲಾಗಿ ಕಡೆಯಲ್ಲಿ ಕೇಳಿದ್ರೆ ಬೆಟರ್ ಇಲ್ವಾ?
ಓಕೆ ಸರ್, ರೈಟ್.
ನಾನು
ಕಾನ್ಸೆಪ್ಷನ್ ಕ್ಲಾರಿಟಿ ಅವಾಗೆ ಮಾಡ್ಕೊಂಡ್ರೆ ಚೆನ್ನಾಗಿ ಅಂತ ಅಷ್ಟೇ ಸರ್. ಮತ್ತೆ
ಹೌದಾ, ಬಟ್ ಕ್ಯಾನ್ ಯು ಮೇಕ್ ಎ ನೋಟ್ ಆಫ್ ಇಟ್ ಅಂಡ್ ದೆನ್ ಆಸ್ಕ್ ಮಿ ಅಟ್ ದ ಎಂಡ್?
ನಾಟ್ ಎ ಪ್ರಾಬ್ಲಮ್ ಸರ್.
That is good always. Okay. Because if you ask a question, I will give some answer, I will go somewhere else, and finally we don't know where we are. Okay. Friends, methodological work habits. Your approach must be flexible, not a rigid procedure. Accepting the responsibility is another requirement. Always optimistic. And the last two requirements are follow all ethical issues of the profession. We have certain ethical issues of counseling also. For example, confidentiality. Whatever information the person gives, keep it confidential and don't share this information with unconcerned persons. This is what we say confidentiality. Informed consent, privacy. These are all ethical issues in the profession that we have to follow. And next is culturally, you must be very, very sensitive to the culture of the individual. Respect the culture, respect the traditions, respect the way of life of people. These are all the requirements to become a counselor. I'm sure that you have all the requirements. And the last requirement is qualification. To become a counselor, you need a qualification, a certificate or a diploma in counseling would be preferred, because some institutions insist for qualification. For example, we have Rehabilitation Council of India, a government organization established through an act of parliament. This Rehabilitation Council of India recognizes your academic qualification, and finally it issues a certificate whether you can practice this type of service programs. That means, for example, to work in the field of disabled, you need to get a certificate from RCA, Rehabilitation Council of India. This certificate is issued on the basis of your qualification, on the basis of the course content also. When once you get the certificate from RCA, you are allowed to practice the counseling or rehabilitation in the field specified. That's the reason we say education is important. These are all the requirements of a counselor. Now, coming to the types of counseling. Broadly, there are two types of counseling. One is face-to-face counseling. When a person has a problem, he comes to you, you talk to him and provide help to him. This is a traditional way of helping people. This is a traditional way of therapy, involving interactions with a professional whom we would meet personally. It's a very, very successful method of intervention. We also have online counseling. When you say online counseling, it is in the form of a teletherapy. It can be e-therapy. It can be web counseling also. But there are advantages are there. And there are some disadvantages also, this type of counseling. The disadvantage is that there is no anonymity and privacy. And you cannot depend completely on the technology. So I feel that, according to me, face-to-face counseling would be a preferred one than online counseling. Okay, now come to the slides. What is counseling? Counseling is a behavior change strategy involving direct contact with the client, and by definition, counseling is a remedial process. A very, very comprehensive definition. Counseling is a remedial process. Remedy means a solution, treatment. Process means a series of progressive steps. There is a definite procedure that we follow. A doctor follows a procedure. He will go for investigation first. Then he will go for diagnosis, then the treatment, then follow-up, then termination. This is called as a process. Same way in counseling also, we have a definite process that we follow. Primarily, it is for solution of the problems. It is a behavior change strategy, changing the behavior of the individual from negative behavior to positive behavior, from unaccepted behavior to the accepted behavior, involving direct contact, face-to-face contact with the client. You sit before the client, talk to him, understand his situation also, analyze the situation, and finally arrive at a conclusion and implement the proposal, whatever you arrive at. This is a counseling. Second is essentially, the second definition, essentially counseling involves an attempt to help the individual to mobilize his own resources. We believe that every individual is talented. We believe every individual is worthy. We also believe that every individual is capable of solving his own problem if opportunity is given, if support is provided. So in this type of counseling, the counselor provides support only. And finally, the individual is able to understand his own potential, mobilize his own resources, and utilize them to resolve certain difficulties which confront him. He is the decision maker of his own future. He decides the solution. You are there to motivate him. You are there to stimulate him. And finally, it is the client who decides what is to be done because it is his life. So this is second definition. The third definition is counseling is to empower the client. It is to make him powerful, not to giving power to him. Empowerment means making the person powerful to cope with the life situations. When I say life situations, means in day-to-day problems. It can be an academic problem, it can be a personal problem, it can be an interpersonal problem, it can be a routine problems also, some inconveniences. A family problem, a personal problem, an interactional problem. So counseling is to empower the client to cope with the life situations. One, to reduce the emotional stress. We believe that stress is a part of life. Stress is inevitable also. But too much stress will lead to frustration. And too little stress also may lead to some other problem. Hence, we need optimum level of stress that is desirable also. Through counseling, you can reduce the emotional stress of an individual if there is overreaction to the stress. Third one is to engage in growth-producing opportunity activities and to make effective decisions. Finally, the counselor will decide what is good for him. Counseling is meant for meant for enhancing the lifestyle of the individual. Next definition is counseling means rendering intellectual and emotional support for helping and developing a distressed person, helping those people who are in trouble, who have problems. So this is what counseling is. Next, the facts of counseling. Counseling is not a highly technical subject. Not a highly technical subject. We all can be good counselors also. But what do you mean by good counseling? Good counseling does not take a lot of time, especially if the approach is tailored to the client's needs. If you are able to understand the client, if you are able to understand his problem, if you are able to make a right kind of diagnosis, treatment always becomes simple. A good doctor is one who takes more time for diagnosis and less time for treatment. Between the two, diagnosis is more important. When you make a right diagnosis, treatment becomes simple. So good counseling need not take a long time. If you are able to understand the cause of the problem, if you are able to pinpoint the situation, help becomes very easy. It doesn't take more time. Second one is good counseling makes clients satisfied. Good counseling, if you give, they will be very, very happy at the end. But training is required for providing good counseling. Some amount of training is required, not long-term training. Short-term training is okay to become good counselors. Good counseling is flexible. It is not a rigid one. Counseling depends upon the person, the problem, the situation. Analyze that one and it becomes very simple. Not all clients require the same process. Some are well informed. Those who are well informed, you resort to one type of technique of counseling, and some are ignorant of many things. For them, you resort to some other technique of counseling. All do not require the same medicine. Some require pediatric medicine is different from adult medicine. Pediatric dose, we say. Some person, those who are highly intelligent, those who are able to manage their own life, the approach of counseling is different. Other person, those who are ignorant, those who are very innocent, our approach will always be different. What do you expect? What is the expected outcome of counseling? The personal changes to be achieved through personal counseling are: one, deeper self-knowledge. This is what we say insight. Insight into your own self. If you are able to understand your own self, the negative one, the positive one, what I am, what I can do. The second one is through counseling, you can bring a change of the attitude from negative attitude to positive attitude. You can modify the self-perception. If you feel inferior, if you have depressive features, if you condemn yourself, if you say that I am useless, I am worthless, these features are very, very dangerous one. That's what we say, features of depression. You can modify the self-perception through counseling. A modification of the perception of others also can be modified, can be changed through counseling. These are all the expected changes. Now, what is the difference between counseling and psychotherapy? Some people say that counseling and psychotherapy are one and the same. But professionals trained in psychotherapy, trained in counseling, do not try to make any distinction whether they are engaged in counseling or psychotherapy. They don't differentiate much, but we differentiate. What is the difference? The term psychotherapy, here we are using the word therapy. Therapy means treatment. So you say that counseling is a technique to deal with the problems of day-to-day living. It is a marital problem, a family problem, an academic problem, a problem with others, interpersonal problems. These problems can very well be tackled with the technique counseling. So counseling is a technique which we use for less disturbed people. Those who have day-to-day problems, those who have adjustment problems, for them, counseling is the remedy. But psychotherapy differs. Psychotherapy deals with the deep-rooted problems. Deep-rooted problems. For example, mental illness like neurosis, obsessive-compulsive neurosis, or depression, or anxiety. For this type of problems, psychotherapy is required. Counseling will not be very much effective because counseling works at superficial level, whereas psychotherapy goes into the depth of the issues and you can manage the problem with psychotherapy. So that is the difference between psychotherapy and psychotherapy. The difference between psychotherapy and counseling is a controversial point even today. Most psychologists today would agree to a difference of degree rather than in kind. Psychotherapy is practiced mostly by psychiatrists, clinical psychologists, and psychiatric social workers. The goal of psychotherapy is to bring about a desired behavioral change in neurotic patients, alcoholics, drug dependents. For these problems, we suggest psychotherapy. This requires many sessions and it may last for months and years also. Psychotherapy is a prolonged technique, whereas counseling is a short-term technique. Personal counseling, on the other hand, is practiced by counseling psychologists, marriage counselors, family counselors, social workers, and all teachers. People who go for counseling are normal people. They are all normal people, but they have adjustment problems. They are all normal people who need help to cope with their personal problems. That's counseling. Okay, friends, up to here, if you have any question, you can ask me and then I'll proceed afterwards. We have broadly three types or three approaches of counseling. And these approaches will be explained in detail. Before that, one or two persons wanted to ask some questions. Can you raise the question now, please? ಯಾರೋ ಕೇಳಬೇಕಂದ್ರೆ ಸ್ವಲ್ಪ ಕೇಳ್ತೀರಾ ಕ್ವಶನ್? Please limit your question to the presentation made.
Sir, one question, sir.
ಕೇಳಮ್ಮ.
Sir, ಇವಾಗ ನೀವು ಕೌನ್ಸಿಲಿಂಗ್ ಬಗ್ಗೆ ಮತ್ತು ಸೈಕೋಥೆರಪಿ ಎರಡು ಹೇಳಿದ್ರಿ ಸರ್ ಇವಾಗ. Psychotherapy is to bring about delivered behavioral changes ಅಂತಂದ್ರಿ. ಸೊ ಇದನ್ನ ನಾವು ಆಲ್ಕೋಹಾಲಿಕ್ ಪೇಷಂಟ್ಸ್ ಗೆ ಯಾವ ತರ ಸೈಕೋಥೆರಪಿ ಮಾಡಿದ್ರೆ ಎಷ್ಟು ಮಟ್ಟಿಗೆ ಅದು ಸಕ್ಸಸ್ ಆಗುತ್ತೆ ಸರ್?
ಒಂದು ಆಲ್ಕೋಹಾಲಿಸಮ್ ಡ್ರಗ್ ಡಿಪೆಂಡೆನ್ಸಿದಲ್ಲಿ we use behavior therapy. That's one form of psychotherapy.
ಹೌದು ಸರ್.
That therapy we use. But the success of the therapy depends upon the individual, his family, and his personal background. For example, if the person is well motivated, if he has a very good family support, if he has a very good job to depend on, if he is financially well off, then the prognosis or chances of recovery are better. But if a person is less motivated, if a person is not at all motivated, whatever therapy you give, psychotherapy, it will not be very fruitful. In most of the cases, what we say, relapse. Relapse means the person comes back with the same problem.
ಸರ್ ನಾನು ಒಂದು ಪ್ರೆಸೆಂಟ್ ಎಕ್ಸಾಂಪಲ್ ಹೇಳ್ತೀನಿ ಸರ್, ನಡೆದಿದ್ದು ಪ್ರಾಕ್ಟಿಕಲ್ ಆಗಿ. ಒಬ್ರು ನಮ್ದು ರಿಲೇಷನ್ ಆಗ್ಬೇಕು ಸರ್. ಈಸ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಪರ್ಸನಾಲಿಟಿ ಸರ್. ಈಸ್ ವರ್ಕಿಂಗ್ ಇನ್ ರಾಬರ್ಟ್ ಬಾಷ್ ಕಂಪನಿ ಸರ್. ಸರ್ ಅವ್ರು ಏನಾಯ್ತು ಸರ್ ಅಂತಂದ್ರೆ, ಇಷ್ಟೊಂದು ಇಂಟೆಲಿಜೆಂಟ್, ಇಷ್ಟೊಂದು ಸಾಫ್ಟ್ವೇರ್ ಫೀಲ್ಡ್ ಅಲ್ಲಿ ಮುಂದುವರೆದಿದ್ರು ಅಂತಂದ್ರೆ, ಈಸ್ ಬಿಕಮ್ ಎ ಆಲ್ಕೋಹಾಲಿಕ್. ಇವಾಗ ಹೇಗಾಗಿದೆ ಅಂತಂದ್ರೆ, ಈಗ ಜನರಲ್ ಕಾಮನ್ ಮ್ಯಾನ್ ಕಿಂತಲೂ ಕೂಡ ಅಷ್ಟಿರೋಷ್ಟು ಬೇಸಿಕ್ ನಾಲೆಜ್ ಇರ್ಲಾರ್ದ ತರ ಆ ತರ ಸ್ಟ್ರೆಸ್ ತಗೊಂಡು ಇದು ಮಾಡಿದಾರೆ. ಸೈಕೋಥೆರಪಿನೂ ಇದು ಆಯ್ತು ಸರ್, ಇದನ್ನು ಆಯ್ತು, ಎರಡೂ ಆಯ್ತು. ಬಟ್ ಅವರು ಈಸ್ ನಾಟ್ ಕ್ಯೂರ್ಡ್ ಸರ್.
That's what just hold on. That's what I said. Unless the person is motivated. The motivation is more important. ನಾನು ಈ ಚಟ ಬಿಡಬೇಕು. But I'm just telling you, please listen to me. ನಾನು ಬಿಡಲೇಬೇಕು, ಬಟ್ ನಾನು ಏನು ಮಾಡಬೇಕೋ ಗೊತ್ತಿಲ್ಲ. ಪ್ಲೀಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಟೂ ಕಂಡೀಷನ್ಸ್. ನಾನು ಇದು ಬಿಡಲೇಬೇಕು, ಬಟ್ ಏನು ಮಾಡಬೇಕೋ ಗೊತ್ತಿಲ್ಲ. ಇಫ್ ದ ಪರ್ಸನ್ ಸೇಸ್ ಹೆಲ್ಪ್ ಕ್ಯಾನ್ ಬಿ ರೆಂಡರ್ಡ್ ಟು ಹಿಮ್ ಈಸಿಲಿ. ನಾನು ಬಿಡಬೇಕು ಅಂತ ಹೇಳ್ತಾನೆ ಇಲ್ಲ, ನನಗೆ ಇದೇ ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಬಲವಂತವಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿದ್ರು ದಟ್ ವಿಲ್ ನಾಟ್ ಬಿ ಯೂಸ್ಫುಲ್. ದಟ್ಸ್ ವಾಟ್ ಐ ಸೇ ರಿಲ್ಯಾಪ್ಸ್. ರಿಲ್ಯಾಪ್ಸ್ ಮೀನ್ಸ್ ಗೆಟಿಂಗ್ ಬ್ಯಾಕ್ ಇನ್ ಟು ದ ಸೇಮ್ ಪ್ರಾಬ್ಲಮ್ ಅಗೈನ್. Case of drug addicts and alcoholics, the relapse rate is very, very high because the motivation is not up to the expected level. This can be done. That's what I said. If the person has a good family background, if you don't have very bad friends, ಸಾಧಾರಣವಾಗಿ 5 ಗಂಟೆ ಕೆಲಸ ಆದ ಮೇಲೆ ಎಲ್ಲಿಗೆ ಹೋಗ್ತೀರಿ ಅನ್ನೋದು ಮುಖ್ಯ. ಮನೆಗೆ ಬಂದವರು ಗುಡ್ ಪೀಪಲ್, ಅದು ಬಿಟ್ಬಿಟ್ಟು ಫ್ರೆಂಡ್ಸ್ ಜೊತೆಗೆ ಹೋಗ್ತೀವಂದ್ರೆ ನೈಟ್ ಯಾವಾಗೋ 10 ಗಂಟೆಗೆ 11 ಗಂಟೆಗೆ ಬರಬಹುದು ಅಂದ್ರೆ probably you are a good workman at the place of work, but you are a very bad family member. You have to perform both your personal life and your occupational life. Both are important. That's what we say, work life balance is important. ಮನೆಗೆ ಲೇಟ್ ಆಗಿ ಬಂದ್ರೆ ಕೆಟ್ಟ ಫ್ರೆಂಡ್ಸ್ ಇದ್ದರೆ ಏನು, that is not a good one. That's why we say for some cases we say alcoholism treatment ಮಾಡಿದ ಮೇಲೆ we will analyze his place of residence. ಎಲ್ಲಿ ವಾಸವಾಗಿದ್ರಿ ಸ್ವಾಮಿ ನೀವು? If your locality is not good, I suggest a change of locality. First one. Second one, I say ಆಫೀಸ್ ಆದ ತಕ್ಷಣ ಮನೆಗೆ ಬರಬೇಕು. Take the children for an outing. Once in a week, you go with the family to a temple or any other religious places. Change your lifestyle. That is one part of the treatment. There is no medicine to correct the problem of alcoholism. It is a behavior problem. That behavior has to be altered. Behavior has to be corrected. Behavior can be corrected because behavior is not what you acquire, what you get it from the parents. Behavior is what you learn from others. Behavior is a learning thing, hence you can unlearn the behavior. ಕೆಟ್ಟ ವರ್ತನೆ ಏನಿದೆಯೋ ಅದು ಬಿಡಬೇಕು. ಕೆಟ್ಟ ಫ್ರೆಂಡ್ಸ್ಗೆ ದೂರವಾಗಿ ಇರಬೇಕು. ಕೆಟ್ಟ ಸಿಚುವೇಶನ್ಸ್ ಇದ್ರೆ ದೂರವಾಗಿ ಇರಬೇಕು. So one person asked, he has given a solution to the problem. How to bring a work-life balance very well. He has given three suggestions. If you follow all three, definitely you will have peace of mind. What are the three? First one is, don't delay your lunch. Don't postpone your lunch. ಕಾಲೇಜಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ರು 1 ಗಂಟೆ 2 ಗಂಟೆ ನಡುವದಲ್ಲಿ ಊಟ ಮಾಡಬೇಕು ಅನ್ಕೊಂಡಿದ್ರೆ ಎಷ್ಟು ಕೆಲಸ ಇದ್ರು ಆ ಟೈಮ್ಗೆ ಊಟ ಮಾಡಬೇಕು. ಇದು ಫಸ್ಟ್ ಒನ್. Tell your principal not to conduct any meeting during that time. Don't have any other assignment during that time as far as possible, because you have to take your lunch at 1 o'clock. If I say that I have to take lunch between 1 and 1:30, whatever work I have, I will postpone it as far as possible. That is, don't miss your lunch. That is first one. Second thing is, don't carry office work home. College ಕೆಲಸ ಎಲ್ಲ ಮನೆಗೆ ತಗೊಂಡು ಹೋಗ್ಬಿಟ್ಟು ಅಲ್ಲಿ ಕೆಲಸ ಮಾಡಿಬಿಟ್ಟು ಬಂದವರಿಗೆ will have problems only, stress only. ಕಾಲೇಜ್ ಕೆಲಸ ಕಾಲೇಜಲ್ಲೇ ಬಿಟ್ಬಿಡಿ. When once you reach home, that is your personal life, that is your family life. Spend your time with the family, take your children for an outing. That is the time. So don't bring office work home. The third one is, don't work on Sundays and holidays. Sundays and holidays, you be with your family only. We have 3 types of lives. One is college life, that's what we say work life. Second is your family life, and third is your other social life. How much importance you give for all the 3? If you say 30% to office work, 30% or 40% to my family, and 30% for my friends and other outside life, means that is okay, not very much happy. When I say 40% work life, 40% family life, 20% only social life, means probably it is good. If you are able to bring a balance between personal life, social life, and work life, if you are able to bring a balance, all these problems will not come. Okay, ma, that's why I say alcoholism, drug abuse, you require psychotherapy, but psychotherapy works only when you are well motivated. That is the first requirement. If you are not motivated, whatever therapy we give, that is of no use. That's the reason we have relapse rate is very, very high in case of alcoholism and drug abuse. So psychotherapy is a good technique, definitely, but what you need is motivation. That's the reason we say that transfer your job from this place to another place. Change your residence from this place to that place. Come home after office hours are over. Take your children to park every day. Sunday you go with the family for an outing. Every 3 months you go to a temple for worship. Change your life schedule also. Then the problem will be solved. Right, Amma? I think you got the solution for the problem. Okay, madam?
Okay, sir. Thank you.
Okay, any other question, please? Okay, if there is no problem, I'll just proceed further, and afterwards you can ask any other question.
ಸರ್ ಇಲ್ಲಿ ಕನ್ನಡ ಸರ್ ಒಂದು
ಹೇಳಿ.
ಕನ್ನಡದವರು ಇದೀವಿ, ಒಂಚೂರು ಮಧ್ಯ ಮಧ್ಯ ಕನ್ನಡನು ಬಳಸ್ಕೊಳ್ಳಿ ಸರ್. ನನಗೆ
ಇನ್ಸ್ಟ್ರಕ್ಷನ್ಸ್ ಏನು ಅಂದ್ರೆ, ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡಬೇಡಿ ಅನ್ನಿ. ಮಾತಾಡ್ತೀನಿ. One thing you understand, Kannada is not my mother tongue. ನನ್ನ ಭಾಷೆಯಲ್ಲಿ ಮಾತಾಡಲ್ಲ
ಅಲ್ಲ, ಮಾತಾಡಿ.
ಬೇಡ. My mother tongue is Telugu.
ಹಾ,
ಬೇಡ. Okay, ಮಾತಾಡ್ತೀನಿ. Good. Okay. Broad.
ಸ್ವಲ್ಪ ಹೇಳಿ ಸರ್ ಅವಾಗ.
ಮಾತಾಡ್ತೀನಿ. ಇಲ್ಲ because ನಮಗೆ we don't know the.
ಒಂದು 6 ರಿಂದ 7 ಜನ ಕನ್ನಡದವರೇ ಇದೀವಿ. ಹಂಗಾಗಿ ಒಂಚೂರು ನಮಗೂ ಅನುಕೂಲ ಆಗುತ್ತೆ.
ಬಟ್ ಬೇರೆಯವ್ರಿಗೆ ಅನುಕೂಲ ಆಗ್ಬೇಕಿಲ್ವಾ?
ಅಲ್ಲ ಮಧ್ಯ ನಮ್ಗೆ ಮಾತಾಡ್ತಿದ್ರೆ ನಾವು ಒಂಚೂರು ಕ್ಯೂರಿಯಸ್ ಚೆನ್ನಾಗಿ ಕಂಟಿನ್ಯೂ ಆಗುತ್ತೆ.
ಟೆಂಪಲ್ ಅಲ್ಲಿ ಹೇಳ್ತಾರೆ ಮಧ್ಯ ಪಾನೀಯಾನಿ ಆ ತರ ಎಲ್ಲ.
ತೆಲುಗು ಚಪ್ಪಲ್ ಸರ್, ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಸರ್.
Friends, there are mainly 3 types or 3 approaches of counseling. Please understand, I will explain very slowly, but these things are important because they are all practical aspects. The first one is a directive counseling. Directive counseling, that's called as a directive. Direction. ನಿರ್ದೇಶಿಸುವ ಆಪ್ತ ಸಮಾಲೋಚನೆ. The founder of this type of counseling is E.G. Williamson. There is another name for directive counseling that is called counselor-centered approach. I repeat again, counselor means a person who provides counseling. Counselee means the person who receives counseling. ಸಹಾಯ ಮಾಡುವವರು, ಸಹಾಯ ಪಡೆಯುವವರು. ಸಹಾಯ ಸೇವೆಗಳು ಮಾಡುವವರು ಕೌನ್ಸಿಲರ್ ಆಗಿದ್ದರೆ, ಸೇವೆಗಳು ಪಡೆಯುವವರು ಕೌನ್ಸಿಲಿ ಆರ್ ಕ್ಲೈಂಟ್ ಅಂತೀವಿ. So it is counselor centered approach, or it is also called as a prescriptive counseling because you give a prescription. Prescription means you do this. That's called prescription. This type of counseling is based on the assumption that the client cannot solve his own problem. ಸಮಸ್ಯೆ ಅರ್ಥಿ ಅವನ ಕೈಯಲ್ಲಿ ಈ ಸಮಸ್ಯೆ ಪರಿಷ್ಕಾರ ಮಾಡುವುದಕ್ಕೆ ಆಗುವುದೇ ಇಲ್ಲ. ಎಸ್ ಅಮ್ಮ, ಹಲೋ. Okay, so but disturbance is like kasta aguttamma in counseling also. Okay. Counseling based on the assumption that the client cannot solve his own problem. The client is innocent. The client is ignorant. So this type of counseling, in this type of counseling, the counselor is a superior. The counselor is the boss. The counselor will prescribe what is to be done after listening to his problem. Client ಏನು ಮಾಡಬೇಕು ಅಂದ್ರೆ, ನಿಮ್ಮ ಸಮಸ್ಯೆ ಹೇಳಿ ಸ್ವಾಮಿ ಫಸ್ಟ್. ನಿಮ್ಮ ಸಮಸ್ಯೆ ಹೇಳಿದ ಮೇಲೆ, ಸಮಸ್ಯೆಗಳಿಗೆ ಕಾರಣ ತಿಳ್ಕೊಂಡಿದ್ದ ಮೇಲೆ, ಎಲ್ಲ ಅಧ್ಯಯನ ಮಾಡಿದ ಮೇಲೆ, ನಿಮ್ಮ ಸಮಸ್ಯೆ ಏನು ಅನ್ನುವುದು ನಾನು ಹೇಳ್ತೀನಿ. ನಿಮ್ಮ ಸಮಸ್ಯೆಗೆ ಪರಿಷ್ಕಾರ ಏನು ಅನ್ನುವುದು ನಾನು ಹೇಳ್ತೀನಿ. ನಾನು ಹೇಳಿದ್ದೇ ನೀವು ಮಾಡಬೇಕು. ದಿಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಅ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್. ಐ ಆಮ್ ಪ್ರಿಸ್ಕ್ರೈಬಿಂಗ್ ಟು ಯು ವಾಟ್ ಯು ಶುಡ್ ಡೂ. ವಾಟ್ ಈಸ್ ಯುವರ್, ನಿಮ್ಮ ವರ್ಕ್ ಏನು ಅಂದ್ರೆ, ಡೂ ವಾಟ್ ಐ ಸೇ. ನಾನು ಏನು ಹೇಳ್ತೀನೋ ಅದೇ ಕೆಲಸ ನೀವು ಮಾಡಬೇಕು. ಯಾಕಂದ್ರೆ ಯು ಕೆನಾಟ್ ಥಿಂಕ್ ಆನ್ ಯುವರ್ ಓನ್. ಯು ಡು ನಾಟ್ ನೋ ಥಿಂಗ್ಸ್ ವೆಲ್. You are innocent person. You are ignorant person. You don't have the ability to analyze your own problem. Hence, I am here to listen to you. I am here to analyze your problem. Answer my questions. I will understand your problem. I will make a diagnosis. I will plan the treatment. Everything I suggest. Only thing what you should do is do what I say. This is called as a directive type of counseling, and hence it is called as counselor-centered counseling. The counselor directs what the client should do. That's why it is called as a directive counseling. I am directing you. ನಿರ್ದೇಶನ ನಿಮಗೆ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ದಾರಿ ತೋರಿಸ್ತಾ ಇದ್ದೀನಿ. In this type of counseling, the counselor talks more. Counselor ಜಾಸ್ತಿ ಮಾತಾಡುವುದು. Counselor is an authoritative person. He says that I know things. You have come to me. Nanage ee samasye gottu. Nanage ee samasye bagge ಸಂಪೂರ್ಣವಾಗಿ ಮಾಹಿತಿ ಇದೆ. ನಾನು ಈ ಕ್ಷೇತ್ರದಲ್ಲಿ ದಕ್ಷ ವ್ಯಕ್ತಿ. ನನ್ನ ಬಿಟ್ಟು ಬೇರೆ ಯಾರೂ ಇಲ್ಲ ಅಂತ ಹೇಳ್ಬೋದು. So you have come to a right place. I have the knowledge. I have the ability. I have the skill. I can understand your problem very well. So he talks more. You answer my question. ನಾನು ಕೇಳಿದ ಪ್ರಶ್ನೆಗಳಿಗೆ ನೀವು ಉತ್ತರ ಹೇಳಿ. ಸಾಧಾರಣವಾಗಿ ಈ ವಿಧವಾದ ಕೌನ್ಸಿಲಿಂಗ್ ಅಲ್ಲಿ the counselor asks more questions and the counselee will answer all the questions. Very rarely he asks questions. ಕೌನ್ಸಿಲಿ ತುಂಬಾ ರೇರ್ ಆಗಿ ಅವರ ಪ್ರಶ್ನೆ ಕೇಳುವುದು, ಇವರೇ ಪ್ರಶ್ನೆಗಳು ಕೇಳುವುದು, ಅವರು ಉತ್ತರ ಕೊಡುವುದು. This type of counseling focuses more on the problem and not on the person. What problem the person has is more important than what person has the problem. Between problem and person, which is more important is problem is more important. Who the person is next. This type of counseling pays greater importance to the intellectual aspects than emotional aspects. ಭಾವನಾತ್ಮಕ ಅಂಶಗಳಿಗೆ ತುಂಬಾ ಕಡಿಮೆ ಗಮನ ಕೊಡುವುದು ಮತ್ತು ಸಮಸ್ಯೆಗೆ ಜಾಸ್ತಿ ಮಾಹಿತಿ ಜ್ಞಾನ ಕೊಡುವುದು. The function of the counselee or the client is to cooperate with the counselor in the whole process. Counselee plays a very, very passive role. Passive role means ಅವರ ಪ್ರಶ್ನೆಗಳು ಕೇಳುವುದು, ನಾನು ಉತ್ತರ ಹೇಳುವುದು ಅಷ್ಟೇ ಸ್ವಾಮಿ, ನಾನೇನು ಪ್ರಶ್ನೆಗಳು ಕೇಳುವುದೇ ಇಲ್ಲ. So when you take the summary of the directive type of counseling, the first one is who takes the responsibility of solving the problem of the client. The counselor takes the responsibility. Solution of the problem is in the counselor's responsibility. Second is status. The counselor is superior and knows what to do. Counselor occupies a higher position and the client occupies a lower position. The responsibility is, I am here to help you. Don't bother about other things. The same thing doctor says, don't bother about the problem. I am here to help you. I take the responsibility of treating you because I know things very well. I occupy a higher position. The counselee is psychologically dependent on the counselor for choosing a solution. Here the client is a dependent on the counselor. And emphasis of this counseling is on the surface symptoms only. Solution of the problem, current problem is more important. We don't go into the depth of the issues only. We deal with issues at superficial level. So this is the first type of counseling. For some persons, this type of counseling is very, very effective. Those who are innocent, those who are ignorant, those who do not know things very well, for them, this type of counseling will be very useful. This can be used with the students also. Some students are very innocent people. ಏನು ಗೊತ್ತಿಲ್ಲ ಅವರಿಗೆ, ಏನು ಮಾಡಬೇಕು ಅಂತ ಗೊತ್ತಿಲ್ಲ, ಪರೀಕ್ಷೆ ಅನ್ನೋದು ಒಂದು ಭಯ. That's what we say a normative stress. When they say normative stress means these are all the expected stresses of students. ಹಾಸ್ಟೆಲ್ಗೆ ಹೋಗಬೇಕು ಅಂದ್ರೆ ಫಸ್ಟ್ ಟೈಮ್ ಸ್ಟ್ರೆಸ್, ಕೋರ್ಸ್ಗೆ ಸೇರಬೇಕು ಅಂದ್ರೆ ಸ್ಟ್ರೆಸ್, ಪರೀಕ್ಷೆ ಬರೆಯಬೇಕು ಅಂದ್ರೆ ಸ್ಟ್ರೆಸ್. This is called normative stress. There may be interpersonal stresses may be there in the colleges also between the friends. Academic stress. Recently, you see many persons have committed suicide. Almost 40 persons committed suicide in IITs. Based on that, the UGC has brought a new system in the colleges that we need to have student service centers, SSC, that's called as counseling centers on the campus. We need counseling centers on the campus. We want to make education as a very, very pleasurable activity, not a painful activity. Everything should be student friendly. Students may have problems, personal problems may be there. They want to share with you. Receive them. Talk to them. Listen to them. Help them. This you can definitely do along with your regular academic work. Good thing you are a good teacher in the classroom. But is it enough? According to me, that is not enough. You have to deal with the students also very well. The students love you a lot at the end. Remember that the students remember you lifelong. If you deal with them, show concern to them, talk to them. That is what we have identified recently when the pandemic was very, very severe in India. Coronavirus, COVID-19. Many universities have started counseling centers around the clock. Counseling, online counseling for people. NIM started an online counseling center around the clock. I'm a visiting professor of Rural Development University at Gadak. We all did one thing good. During that pandemic time, we approached almost all students over the phone. Talk to them. How are you? How are things at home? Do you need any help from our side? Only 3-4 things only. This gives a lot of confidence to the students. They love you a lot at the end. Show concern for them. Interpersonal problems may be there in the colleges and in the universities. Academic problems. Normative stress, that's what I said. And about the career, what to do after the education, after completing the course, that is also you have to provide counseling to them. Some students are very, very innocent students, very ignorant. Talk to them well. So from that point of view, I say directive counseling is very, very effective. We have the second one called as non-directive counseling or client-centered counseling. Non-directive, ನಿರ್ದೇಶನ ರಹಿತವಾಗಿ ಇರುವ ಆಪ್ತ ಸಮಾಲೋಚನೆ. ಮೊದಲನೆಯದು ನಿರ್ದೇಶನ ಮಾಡುವುದು. I am directing you, you go in this way. ಅದು ಹೇಳುವುದು directive. Non-directive one is I don't give any direction to you. It is called as a client-centered approach. It is client-centered approach. It is client-dominated approach. The leading supporter of this type of counseling is Carl Rogers. Very, very popular technique of counseling. This type of counseling believes it depends more on the quality of relationship. How do you establish your relationship with the client is more important than your theoretical aspects.